Hi, I'm Casey Seiler, editor of the Times-Union. Welcome to the 2020 Salute to Nurses, an event that I very much wish we could be holding in person. Over the course of the last several months, we have all heard inspiring stories of workers who have overcome obstacles and even braved physical peril to get their jobs done, a list that includes truckers and restaurant workers to occasionally even journalists. But of course, no one has been on the front lines more than New York's health professionals, especially nurses, who helped get us through the bad weeks in the spring when the state represented the nation's hotspot for COVID-19. To celebrate some of the people who helped get us through, it gives me great pleasure to introduce the host of this virtual celebration, Times-Union's healthcare reporter, Bethany.
Hello, and thank you so much for joining us today to celebrate some of the Capital Region's most outstanding public servants. For the past 7 months, I have been covering the COVID-19 pandemic for the Times-Union, and during that time, I've had the opportunity to speak with nurses from around the region. The nurses I've spoken with work in a variety of places. They work in our local hospitals, our local nursing homes, our home care agencies. They were nurses who volunteered to work on the front lines in New York City when those hospitals were being overrun. Of course, I also spoke to nurses working on the front lines locally. Here in the Capital Region, as you know, we saw not just local COVID patients, but also patients who had to be transferred in from downstate, where hospitals there were being overwhelmed very quickly. And I also spoke with nurses from our local nursing homes, where it had become clear very early on that they would be the center of a lot of outbreaks, and unfortunately we did see that play out. So in speaking with them, I clearly got a sense of the fear and anxiety that accompanied the job at that time, and that I think still accompanies the job. It was a time when PPE guidelines were hazy. It wasn't clear if there would be fresh PPE at all. Their colleagues were falling sick. The rules were changing on a daily, sometimes an hourly basis. And nurses also knew and accepted that they'd have to quarantine to keep their families safe, to keep us safe. And yet nurses still showed up. And I want to note that nurses have not just shown up this year to deal with a pandemic. They've been dealing with everything they've always been dealing with: chronic disease, everyday illnesses, births, deaths, heart attacks, accidents. We know that those don't just stop in a pandemic. On top of that, we had an incredibly violent summer here in the Capital Region. Record shootings, many of them fatal. We've seen the mental and emotional stresses of the pandemic bleed over into high overdose rates, more suicides. It's been a hard year, to say the least. But our nurses have been there through all of it, which is why we're here today, talking at you from behind a screen, because even though we're not able to hold our usual Salute to Nurses celebration, the one that comes with a fancy catered lunch, we knew we wanted to gather some way, somehow, to celebrate the nurses in the Capital Region who have never stopped showing up. Each year we ask the community to nominate an exceptional nurse in their life. This year, probably to no one's surprise, we received a record 625 nominations from patients, fellow nurses, doctors, administrators, family members, and others. We could only pick 10, but every one of the nurses who were nominated this year deserve our recognition and our gratitude for their unwavering commitment and dedication to their craft. So before I introduce you to the winners of our 2020 Salute to Nurses celebration, I'm going to turn it over briefly to Dr. Stephen Hanks, Chief Medical Officer of Acute Care at St. Peter's Health Partners. He's going to tell us a little bit more about the role nurses have played in guiding us through this whirlwind of a year.
I'm Stephen Hanks, the Chief Clinical Officer at St. Peter's Health Partners, and I couldn't be more pleased to address this group. Last year, the World Health Organization declared that 2020 would be the Year of the Nurse in celebration of the 200th birthday of Florence Nightingale, which happened this past May 12th. May 12th every year is International Nurses Day in honor of her birthday. And little did the WHO know how fitting this appellation would be for 2020 as COVID-19 swept in as the latest pandemic to impact humanity. And all I can say is thank heavens for nurses. The profession of nursing has cared for us, nurtured us, comforted us, educated us, and elevated us in good times and bad, in times of war, pandemic and disasters, both natural and man-made. And from Florence Nightingale, the original lady with the lamp, who went around rounding on British soldiers in the middle of the 19th century at night, tent to tent, carrying her lamp from soldier to soldier and tending to the injured, to Dorothea Dix, Clara Barton, and Louisa May Alcott, the so-called Little Women of the Civil War, to the untold number of nurses who saw us through the twin scourges of World War I and the Spanish flu, to the Army and Navy Corps of nursing who saw us through World War II and were then joined by the Air Force Corps of nurses in Korea, Vietnam, and right up to the present day. Through AIDS, SARS, Ebola, MERS, and now COVID-19, nurses have been there as a steadfast presence to care and comfort us all in our times of greatest need, and often at great personal risk. I'd like to read one story for you that epitomizes nursing at its finest. And the year was 1918, and the Great War, as it was known at the time, was nearing an end. And as if the horror of the trenches were not enough, the world was stricken with the worst influenza pandemic in known history, the so-called Spanish flu. And when it had run its course, over 50 million people worldwide had perished, 675,000 of them in the United States alone. And just to put that into perspective, on a per capita basis, that would be equivalent to a flu season claiming 2 million people today. And our typical flu season, we average around 35,000 fatalities. So you can see roughly 10 times what is normal and what we've experienced with COVID-19 to date. This influenza in 1918 was so severe and overwhelming that there were multiple stories of people getting sick in the morning and being dead by the end of the day or by the next day. And in the midst of this raging pandemic, the following story from Chicago is recounted. One of the nurses, as she was leaving a patient's house, received a call from the opposite side of the street. When she arrived, she was met at the door by a 10-year-old girl who said that her father, mother, brother, and sister were ill in bed. On going upstairs, the mother was found to be desperately ill with pneumonia, and a little boy of 8 and a girl of 2, also very ill with pneumonia, in the same room. In a crib beside the mother's bed was a 6-week-old baby who had not been bathed for 4 days and was wet and cold. Though the father had influenza and was running a temperature of 103, he was doing what he could do to get out of bed from time to time to care for his wife and children, the only other attention they received being from the 10-year-old girl. The house was cold, as the family had no coal, and the children were shivering and hungry. The nurse gave care to the sick and bathed and fed the baby. She made a wood fire in the stove and prepared food for the other children. She then found a kind neighbor to continue to look after the children and make them comfortable. Now, to me, you know what the most amazing thing is about this story? It's that I'm willing to bet just about every nurse who's ever lived would have done exactly the same. For that is what defines your profession: service in the care of others. Which leads me to a reminder for all of you that during this current time of fear and stress, nurses, like other healthcare workers, are at high risk for mental health issues like anxiety, depression, PTSD, and substance abuse disorder. There have been a number of highly publicized cases of death by overdose or suicide among healthcare workers in the midst of this pandemic. It's critical during times like these that you take time to care for yourself. Do as much as you can to try to eat well, sleep well, make time for exercise and exposure to sunlight and nature. Deep breathing, yoga, meditation, a massage, or warm bath, whatever works for you for relaxation, be sure to take time to work that into your day. And if you do find that stress, anxiety, fear, rumination, insomnia, or depression is creeping in and interfering with your functioning, be proactive. Reach out to your friends and family, to your PCP or your employer's EAP program, or avail yourself to any of a number of the great resources that are compiled by the American Nurses Association at their website, which you can easily find online. Most importantly, don't suffer in silence and stoically try to tough it out. Even nurses need care from time to time. So I'll leave you with this. It's one of my favorite quotes from Winston Churchill, who said, "You make a living by what you get, but you make a life by what you give." All of you in the nursing profession embody this ethos of giving every single day. And for that, I salute you. Thank you for all you do.
Many thanks to Dr. Hanks for joining us today. Now, without further ado, let me introduce you to the 2020 winners of the Times Union's annual Salute to Nurses celebration. I'm just going to read you some names and some quick bios, and then you will get to hear directly from them. Heather Brown is a nurse at Albany Medical Center. She began her career there working in the pediatric intensive care unit, a job not for the faint of heart. The care that she delivered to that unique and fragile population earned her the nickname Baby Whisperer due to her ability to calm both the babies and their families during a stressful stay. She was able to bring those skills with her when she joined the hospital's apheresis and infusion unit, where she works today with both children and adults. Donna Herview is another one of our winners. Donna is the program manager at Eddie Daybreak, a role she's held for 23 years. She's worked as a registered nurse for 45 years. She has been described as an extremely giving person and caregiver who treats every patient with dignity and respect, and is someone who doesn't, quote, leave her nurse's cap at the office on Fridays at 5 p.m. Almost every weekend, this person said, she travels out of town to help a close friend care for her elderly, infirm mother. Our next winner is Sue Charmiello, a psychiatric nurse practitioner at Ellis Medicine State Street Health Center. Sue somehow treats 260 patients on a 4-day schedule at Ellis's mental health clinic and personalized recovery-oriented services. She prescribes medication and provides therapy to people with psychiatric conditions ranging from depression and anxiety to schizophrenia and bipolar disorder. She has been described as someone who appreciates hard work and who is patient and flexible, always willing to move her schedule to meet patients where they're at. Jill Thornton is another one of our winners. Jill is a nurse at Philip Schuyler Achievement Academy. She cares for hundreds of Albany's elementary children, treating them for chronic illnesses and daily occurrences of aches, pains, and accidental injuries. With Albany being a hub for immigrants and refugees, she cares for children from all over the world, working with translators to communicate with families and to provide care that is sensitive to cultural differences. Our next winner is Marcy Fiat, a professor and nurse educator at Russell Sage College and a nationally certified nurse midwife who manages obstetric triage on Albany Med's labor and delivery unit. She brings passion to each of these jobs and works to increase awareness for vulnerable populations such as the LGBTQ community. She also volunteers in her community, raising funds for breast and ovarian cancer research and research related to premature births and infant care. Amy Balog is another of our winners. Amy is a nurse with the Bassett Healthcare Network. Her career has spanned primary care, acute care, surgical first assist, home care, and palliative care. She has dedicated her time to volunteer overseas in clinics in Ethiopia, Guatemala, and Haiti. According to the person who nominated Amy, she doesn't just focus on her patients' physical ailments, but makes sure to devote time tending to their social, emotional, and spiritual well-being. Our next winner is Lynn Shaw, a home care nurse with the Visiting Nurses of Albany. Lynn manages a large population of inner-city patients who battle chronic disease and shows great empathy for their socioeconomic needs in addition to their physical needs. She has cared for this community for over 25 years and is known as Lynn the Nurse in Albany's South End neighborhood, where she now cares for the children and grandchildren of her former patients. Carol Wickham is another one of our winners. Carol is a professional practice nurse at St. Peter's Hospital, whose commitment to mentoring young and seasoned nurses is unparalleled. She encourages staff looking to expand their knowledge in professional practice and was instrumental in developing the hospital's nationally recognized Vizient Nurse Residency Program for new graduates. She also leads the hospital's nationally recognized magnet program and travels the country evaluating magnet programs at other healthcare facilities. Our next winner is Beth Vondendriesch, a nurse who has worked for the community hospice for 3 decades in various critical roles. Beth was described as the hospice's go-to person, the person deemed expert in all things by colleagues who turn to her for guidance and education when it comes to specific patient concerns, policies, and regulatory requirements. Beth is described as the mentor and the mom who will take you under her wing, care for you, and arm you with knowledge to make it through complex patient cases. Finally, we have Debbie Streets, lead nurse for the surgical specialists of Glens Falls Hospital, which cares for many elderly patients with complex needs. Debbie takes the extra time to ensure these patients understand their treatment plan, even staying after office hours to talk patients through what they should be doing when they get back home. She treats her fellow nursing staff with the same consideration, making sure everyone has the education and skills needed to carry out their roles, and always making sure everyone feels like a valued member of the team. So those are our winners. I'm going to stop talking now so you can hear directly from them.
I decided to become a nurse because I had a lot of nursing role models in my family, women I looked up to who were strong and capable.
I think I've always wanted to be a nurse. My mother was a nurse.
As far back as I can remember, and you probably hear this a lot, I've always wanted to be a nurse, and it is definitely a ministry that I have felt called to.
I always enjoyed helping people. I feel like I was always either like helping out the new student in class or kind of anybody who needed help.
Becoming a nurse was probably the best decision that I ever made.
I actually never wanted to be a nurse.
I became a nurse not for any heroic means, but my husband is in the military, and so I had gone to school to be a teacher, but because we were traveling around and I wanted my own career that was flexible, and so I went to nursing school.
When I was a freshman in high school, my father became critically ill, and I was in the hospital a lot with my mom, visiting him and my brothers, and I was surrounded by a lot of nurses and saw what they were doing, and it called to me, and I said to my mother, that's what I want to do.
Nursing was something my mother said, well, start off being a nurse's aide and see what you like. Go to the hospital and just be a nurse's aide. So I did, and you know what? And I can't believe I didn't want to be a nurse.
I've always been very proud to say that I was a nurse.
I can't imagine doing anything else. Just can't at all.
It's less of a single memory for me as much as it's a conglomeration of all of the things I've been able to be a part of.
I mean, there's so many moments, like little moments that end up becoming important to the patient or make an impact on me.
I don't know that I really have one story, or one favorite memory.
When I think about that question, I have like a million.
I can remember as a new nurse in labor and delivery, like pushing along with my patients as they're pushing their babies out. And I'm like, trying to help them sort of, telepathy, give them that power to get through it.
I have a little boy right now who comes weekly for infusions, and just his face lights up when he sees me, and just his giggles and his smile, it makes my day.
Back when I first started, I worked in pediatrics, and the children with the leukemia, they had a terrible survival rate at that time. They survive now, they do well now. So to have seen that advancement and the changes and what it's done, that's been huge.
when I look at the team of nurses that are around me, these are my memorable moments. The team that we have, the people that we help, the hands that we hold, and the nerves that we calm, and the tears that we wipe away, and the laughs that we have. Oh my gosh, we laugh hysterically sometimes with our patients, and they come in here just to see us sometimes.
Poignant moments are when I worked on inpatients, and patients come in and they're most desperate, they're in despair, they're so vulnerable, to try to help them piece their lives together so that they can kind of get back out in the world and function. And I call it selling hope. That's what I was doing.
We had a 74-year-old woman who had multiple medical needs, who had to be admitted on an emergency basis. But then on top of that, and I'll call her Anna, she was also blind and deaf. My wonderful staff and I had to take a crash course in sign language.
As a palliative care nurse practitioner, I've had these very tender moments with my patients when they're very, very sick, and family members when they're about to pass away. And so to have these moments with my families and the care and the patients, it's some of the most tender moments to be with them during this, the hardest time in their life. And so I get to be with them through that journey that is really priceless.
Thanksgiving, I happened to be on call, and I received a call from her daughter that she had passed. And so I went over to their home, and we did what I usually do. Me and her daughter, we bathed her. We got her into a gown that they wanted to, a new nightgown it was beautiful. We got her positioned nicely in the bed, and she just looked finally so peaceful and just beautiful. And so I said to the daughter, I said, is there any reading or ritual or prayer that you would like to do? And she immediately went to her knees, which kind of startled me. But I knelt down beside her, and I don't know where the words came from, but we prayed together, and we gave thanks for her life, for the love that she had extended to her family, but also gave thanks. I'm sorry, I was going to do this without this. Gave thanks that her earthly struggle was now over. And it really marked my Thanksgiving Day and made all of my Thanksgiving days from that point on very different.
Recently, last June, or maybe it was the end of May, our school had a parade for the kids because we had been away from them for so long. And I was in my car with my daughter, who is also a nurse, and she at the time was working on a COVID floor at St. Peter's Hospital. So she came along with me, and I only had we were supposed to mark our cars as to who we were so that the kids would know who was in the cars, but I simply put nurse on the car and a red medical cross. And it wasn't just our students and their families who were outside for the parade, it was the entire community. And as our car went by, everybody was screaming, "There's the nurse, there's the nurse." And then they all were clapping and cheering and saying, thank you so much. And I said to my daughter, they're cheering for you. They're cheering for all the frontline workers in the hospital, and they're thanking the medical people. So I think that will always be my fondest memory of nursing.
I'll try to keep it PG. Let's see. So the past 9 or 10 months with COVID have been an absolute roller coaster for all of us. And I think we've all been, I read this somewhere, we're all in the same turbulent sea, but maybe we're all in different boats, right?
It's been a little, been a bit of a roller coaster.
Exhausted, courage, fear, exhausted.
And I can't lie, it has been some of the most stressful months in my nursing career.
And I'm going to steal from Elie Wiesel because he was one of my heroes, is one of my heroes, the late Elie Wiesel. Think higher, feel deeper. And, with all of this COVID, nurses have had experience with this in the past, in the Spanish flu epidemic. I just wrote a column for our newsletter about how the nurses treated the patients back during that epidemic, how they survived it. There's many similarities between what they went through and what we've gone through. I mean, of course, the advances are different, but the caring and all of those components that make a nurse were very similar. And, we persevere and we just continue on.
I'm blessed to work with some really amazing coworkers, and kind of from the start, we've just been so supportive. Whether decorating the windows just to add a little bit of cheer to the unit, we had a virtual game night one night just to kind of a way to get together in a safe way and just kind of keep the morale up and continue to support each other and just kind of be there for each other through, a challenging time for everyone.
I will say that a feeling that I had was one of frustration because we're nurses and we weren't able to be with our kids and take care of them and do what we usually do.
I am so overwhelmed by it because it's not something I ever expected in a million years, because it just seems like, this is who I am. And so I am very humbled by it and very honored.
It's just very much an honor for me that someone would take the time to, and especially in these times, to recognize the work that I've done.
It's an honor. I feel like I just go to work every day and it's a calling to be a nurse, and I love my job and my coworkers and my patients, and I feel like it's a joy to get to go to work every day. So
I feel kind of like speechless. I was very surprised when I got the email. I didn't even know I was nominated. I don't even still know who nominated me. I don't even know what is happening.
I also feel humbled, and I also am grateful for the acknowledgement, because I feel like the acknowledgement, I share that honor with all of nurses, but specifically with school nurses.
My initial reaction was very emotional, and I realize there's so many nurses out there, especially now, that just deserve such recognition. I was humbled by the fact that I was chosen among so many to get this special award, and I'm just very grateful.
It's an honor. It's humbling. Knowing that somebody has thought of me enough to submit something like that is very humbling to me. And
Just a remarkable testament for the people that I work with, that they appreciate what I do.
I'm really in awe because I feel like, I don't know, like what did I do different than anybody else who's working hard to, between LPNs, RNs, nurse practitioners, nurse anesthetists, like there's like a million people who are amazing and that I admire. So I don't understand what I did. I have a heart that is full of joy when I talk about nursing. It's full of love for what I do. I really do feel like it's a calling, and it's more than just a job. And if for anyone who thinks they want to get into nursing, know that it will impact you on an emotional level, on a spiritual level, again, whatever that is for you. That's why I do it. So not for the recognition. So to get a recognition like this, really sort of, God, it's hard to put into words, but it really just makes it all come home.
And that's our program. We want to thank all of our winners and finalists for their hard work and dedication. This is a year like no other. We've always known, but I think this year especially proved that nurses are every bit the heroes we've always thought them to be. Thank you to our sponsor, St. Peter's Health Partners, and to the Times Union subscribers who make it possible for us to bring you stories from these brave frontline workers. Thank you again for being with us today. Be well.